Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, brothers and sisters, in this series delivered from Federation of Islamic Medical Association, FIMA. Alhamdulillah, we've been doing this series for a while now, and this is the 10th lecture delivered today by Professor Sharif Al-Ghazal. It's about practice of surgery in the history of Islamic medicine and its influences on modern surgery. We take Al-Alim Al-Zahrawi as an example. I won't take much to introduce Professor Sharif. MashaAllah, he has a lot of titles which reflects his dedication and being active in the community in too many fields, MashaAllah. So without any due delay, let's start with Professor Sharif. تفضل سيدي. بسم الله.
جزاك الله خير أخي. السلام عليكم ورحمة الله. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد خاتم الأنبياء والمرسلين. Yes, Barakallah Feek, Dr. Abdurrahman. This is the webinar number 10 we've been doing, inshallah, about the history of Islamic medicine, which is the initiative we started long time ago. We've been teaching this as part of the British Islamic Medical Association, the HIM-FIMA activities. But we've just done it by the end of 2022 as a formal project as part of the Federation of Islamic Medical Association, the FIMA. Why do we need to learn about history and history of medicine? I really always asked myself this, and I really felt it's really quite important to educate ourselves about the great achievements we all read about it, and probably some of us actually read about it on the figures in the Islamic medical history. Also, I really feel it is quite important to empower, to inspire the future generations in our community, the Muslim generation, who need to know this great achievement. We probably maybe heard when Isaac Newton, he said, if I see further, it's because I'm standing on the shoulders of giants. So we need to learn what these giants they've done to us, and they've done to medicine in general. And I think it's quite important as well is to correct the wrong image. Unfortunately, the Western media reflect about Muslims in general, and obviously here I'm going to focus on the images being given on the field of Islamic history. As you can see here, we're starting. This is a page from a big book called The Short History of Medicine, published in 1962, 600 pages. Hardly you can see even 6 lines talking about the history of Muslims, a medical history of Muslims, or written a few words by Al-Zahrawi. Also, because we are going to focus today on surgery. This is actually surgical book, Principles of Surgery, written by Schwartz. Probably maybe most of us know about it. Hardly you can see anything mentioned on the history of Muslims physicians, because he jumped straight when he talked about the history of ligation of arteries, jumped from what Galen advises to almost 1600 years later, what Paré, the French surgeon, did, without even mentioning anything about Al-Zahrawi. The same can be said when we discuss the pulmonary circulation. They jumped straight from Galen to discuss what William Harvey, and give the credit to William Harvey, and nothing mentioned about the great figure Ibn Nafis, who gets the credit obviously later on, which is only a few years ago. This is actually article published only recently. on giving the credit to Ibn Nafis. So I think we need to see, is this a slide when it talks about the history of science and civilization, and leaving almost 1,000 years away. Is that really true? Is it what they call it, the Dark Ages? Yes, obviously, Europe used to be in the Dark Ages, but was it really Dark Ages everywhere? Or there's some shining places, even in Europe itself, there is some shining cities and shining civilizations going on. We're going to probably maybe inshallah focus on this for the next 45, 50 minutes. So yeah, this is just short list of physicians in the Muslim civilization. They are not all Muslims. Yes, there's probably many Muslims. The vast majority are Muslims, like as we can see, Al-Baghdadi, Al-Razi, Al-Zahrawi, Al-Bayruni, Ibn al-Nafis, Ibn al-Haytham. But there is some Christians as well, like Yahya ibn Ishaq and Jibril ibn Bakhtashu, and there's some Jews as well, like Ibn Rahman and Musa ibn Maymun. They all contributed in the Muslim civilization and on the Islamic part of medical history. They all contributed, just to show how great our religion is, to how tolerant is our religion to deal with other faiths. Yes, I'm going to focus on Al-Zahrawi. I like this figure. I've got really great respect, and I'm going to prove this. Al-Zahrawi is one of the main surgeons in our history. His full name is Abul Qasim Al-Zahrawi. Abul Qasim, this is why is known in the West as Abul Qasis or Al-Buqasis. So he's known as Al-Buqasis. He was born in Spain, brought up in Spain, and died in Spain. I called Spain, yes, it was the Andalus, but I always tell my student, he was a surgeon. I feel attached to him as a surgeon. But again, he's like any Muslim in Europe. He was born and brought up and died in Europe. He was born in a very beautiful city called Medina to Zahra. It was very small city. Lots of rich people from Cordoba used to live in it. Unfortunately, it's completely destroyed after a few years. He died in 1013, almost celebrated the millennium of his death just over 10 years ago. So Al-Zahra was very close to Cordoba. If you have a chance to visit Cordoba, you'll see lots of places called and named behind Al-Zahrawi. This is the street Al-Buqasis, they call it Calais Al-Buqasis. And if you had a chance to see the number 6, it's a deserted place, and this is where Al-Zahrawi used to live. Cordoba was a beautiful place, and it's still a nice place. If you probably imagine, this was one of the shining cities in Europe during the Dark Ages, when and the Middle Ages, when the rest of Europe was really over 500,000 books in Cordoba's library. A great place, lots of places where in Cordoba teach different sciences, and the rich people in Europe, the kings of Europe, used to send their children to learn many different parts of science and medicine also in Andalus and in Cordoba and Granada and Granada during the Golden Age. And one of them actually King Uffa, actually, is a king of England. In fact, he made his currency and put the kalima al-shahada. You can read la ilaha illallah, and some people thought he probably maybe became Muslim. I don't think he was Muslim, but it's just the way they always look at in a great respect to the Muslim in Andalus and try to copy them. And this is Qasr al-Hamra, the great place in Granada and Alhambra place. And you can probably maybe imagine Al-Zahrawi was born here, and he lived in this part of Andalus. It's a beautiful place. So the main achievement of Al-Zahrawi, Al-Zahrawi actually left us with a great book called Al-Tasrif liman ajiza an al-ta'lif, a method of medicine for who cannot write a book. So it means this Al-Tasrif has got everything in this book. He tried to collect almost the up-to-date information he could probably maybe learn from the previous generations, and he put and his experience and his knowledge. We're not going to talk on the book today completely. It's just going to mention the number 30, the last volume. This is actually Al-Tasrif has got, it is actually 30 volumes. So the 30th, the number 30 is only the one which focus on surgery. And this volume has over 180 chapters on different aspects of surgery, on the subspecialties, surgical subspecialties. And he described over 200 illustrations of mainly instruments, surgical instruments, and the way to do surgery. So it is a beautiful, beautiful book. I'm going to probably maybe here put some the main manuscript in Arabic and translate in English on the other side of the slide. So we can start saying Al-Zahrawi used to focus on anatomy. He always tell his student, you cannot start doing surgery without having good knowledge of anatomy. And this is basic science, but he made it in the very first, I mean, this is page number 3, the first a couple of pages, always focus, this is how you start. You need to learn anatomy before you start surgery. Starting with general surgery, he spoke on the suturing the abdomen, closing the abdomen, how you suture the wounds in general, the instrument used to be used for this. And also he agreed with Gallen in couple of techniques, and he disagreed in some. He used to have the critique. He criticized, analyzed what other people said, but he's got his own input as well. And he described the Trendelenburger position almost 100 years even before Trendelenburger himself actually was born, the German physician. Also, he described a few different techniques how to close the intestine. And he used the ant heads by allowing the ant to grip on the wounds both sides and then cut the head after straight after and leave it, and that will be almost like it will get absorbed. Obviously, it's biological, it's the head itself. And he made also stitches made from the sheep intestines. And as we all know, the catgut is very well used till very recently. We have a different absorbent stitches nowadays, but the catgut and the plain catgut was only to very recent years used. And he described also a few different ways to stop arterial bleeding, either by putting pressure by the fingers or using the K, cauterization, and also using a different type of stitch, like the silk, he called it brisine or harir, or using the absorbent stitch, we know the catgut, and he called it awtar al-oud, the absorbent stitches. Is a great physician, and this is well before even Perret actually did, over 500 years. And this has been recognized in many books, and this is a Fred Raymond talking about Al-Zahrawi, Al-Bukhasis, and using the sutures made by the intestines of sheep. Also, Al-Zahrawi, he described a way to treat migraine and severe migraine by ligating the temporal arteries. And that's interesting way to do this. And this has been recognized about Al-Zahrawi by John Ratzenberger in his book Children's Surgery, Worldwide History, which is published in 2012. It's quite interesting way to treat severe migraine. Also in general surgery, he described and spoke treatment of umbilical hernia, نتوء السرة, the hydrocele, al-idra al-ma'iyya, and also al-fatх al-irabi, the inguinal hernia, how to he described it and how to treat it and the surgical technique. He also interestingly actually described the hemorrhoid, the piles, and distinguished between the internal piles and the external piles. He called it بواسير داخل المقعدة, بواسير خارج المقعدة, which is quite well known even nowadays, the way the classification. Talking about thyroidectomy, he distinguished between is this swelling, is it differential diagnosis, is it abscess, is it lipoma, or is it gutter, the thyroid enlargement, and the way to remove the thyroid, enlarged thyroid. And he described it, probably maybe was the first to describe this unsuccessfully, the thyroidectomy, the technique to do this. I'm not saying this, it is actually published in the International Surgery Journal, and the credits being given to Al-Buqasis. Al-Buqasis really probably maybe the first to describe successfully the thyroidectomy operation, and he used the opium as a sedation for this. And this has also been given this accreditation by William Halsted, the one he well known in the mastectomy, and also he talked about Al-Zahrawi and the thyroidectomy, and the credit given to Al-Zahrawi as the first to describe this technique. Pediatric surgery, yes, he described the hypospadias and the way how would you treat it, imperforated anus as well. He called it al-miq'ada ghayr al-mathquba, and how you treat it, how you open the circumcision in a very detailed way. Circumcision, how you do it, what sort of the sedation being given to the child, call it al-murqad sedation, and he always prefers specific instrument he used for the circumcision, and he described them in great details, called it tathir al-sibyan, circumcision. Urology, he described the irrigation of the bladder, also the distinguish between the bladder and the kidney stones, how to remove the bladder stones, and very interestingly, actually, he also made small catheters. Obviously, this is made from silver, using very like a tube. He described it as مجوفة كأنبوب ريش الطائر. It's almost like the feather. It's the little tube to use it as a catheter, which is very similar to the same principle for the Foley catheter we use nowadays in urology. A great surgeon, and this has been described in Fred Raymond's book, and Al-Zahrawi, Al-Buqasis, the device he used as well to remove the stone in the urethra. Vascular surgery, he talked about in chapter 49, he talked about the aneurysm, and he talked in the details to the extent that one of the obstetrician well known called William Hunter, he's a brother, the older brother of John Hunter, the father of surgery in Britain. William Hunter's actually in a book written by Janet Starkey in 1948, he spoke about Al-Zahrawi in details, and how Al-Zahrawi described the treating aneurysm in chapter 49. And obviously William Hunter's, he knows Arabic, he studied Arabic, he visited Aleppo, and he studied Al-Zahrawi's book Al-Tasrif, and it's quite interesting to read about Al-Zahrawi in such way. Trauma orthopedics, I know we had at least a couple of orthopedic surgeons, mashallah, with us this evening. Al-Zahrawi had a great impact in his time, because lots of war injuries and the trauma. And he, interestingly, actually, he described the kosher method probably maybe over 800 years before kosher himself was born, to how to reduce the shoulder dislocation. Also, he advised when you reduce any dislocation, and discussing here fakul mirfaq or khal'ul murfaq. This is actually for the elbow. He said you have to do it straight, otherwise the swelling, call it al-waram al-had, the swelling might really prevent to reduce the dislocation. This is the same principle we teach our students. You have a dislocation case, you have to do it as soon as possible. But if you have a fractures, he advised, he recommended, you have to wait probably 5 to 7 days for the swelling to settle before you put full splint or cylinder splint. So you can put only part of the splint to support the fractures, but don't put quite full splint around the fractures, because that might cause compartment syndrome, obviously. And he described this, and we're going to discuss it later on. Also, he talked about the malunion and the non-union of different fractures. He also described many instruments to perform amputations. And not only this, he described the instrument by giving different instrument for different purpose. So each instrument can serve different purpose and made by different materials, whether it's a copper or using silver or using iron, and he used the black iron as well. So the instruments really made according to the surgical need. Fantastic. And I mean, almost like having full team working with them as a medical physics. And also the way to treat dislocated the vertebra, which is interesting. Treating rib fractures. And he criticized, in fact, Galen. He criticized Galinos, because Galen, he thought probably the best way to do it is to give the person some food which create gas, and the tummy will probably maybe, when the tummy is extended, it will just push the rib fractures out. Obviously, this is not very scientific, and Al-Zahrawi didn't like it. He preferred to incise, lifting it surgically. Plastic surgery, would you believe? Me as a plastic surgeon, when I read some principles Zahrawi talking about, this is fascinating. He also starts with the need for wound debridement. You cannot close infected wound and call it afan. You can't. You need to treat the infected wound before you close it. Before you, before you treat any wound, you have to remove the dead tissue, the infected tissue. The treatment of cleft lip, shiqaq al-shafi, by using the cauterization. Also, he described polydactyly, al-isba' al-zaide, and the syndactyly, when you have, he calls it iltiham al-asabi', and this is a very well-known condition in congenital hand surgery. Eyelid surgery, also the ectropion, which we see quite a lot, and many surgeons, they use the same technique described by Al-Zahrawi, the wedge excision or V-shape excision. Interesting. Gynecomastia, and he called it علاج ثدي الرجال الذي يشبه ثدي النساء. This is interesting, the way he described it, using the C-shape incision, and he drew it as well, put from one side, he drew B and G, and that's interesting way, and they still use this technique at preauricular incision around the areola and remove the extra skin. Cancer surgery, yes, he had lots of recommendation on cancer surgery. He described the cancers mainly about the thigh as well as the breast cancer, and he gave the couple of principles important. You have to to do wider excision, so you have to remove some of the good tissue around the cancer to achieve, as we call it nowadays, oncology clearance. So to make sure the cancer is completely removed, you have to take some of the tissue around it. Not just only this, he says here on this, when I put underlined in red, if إن كان الورم عظيما لا ينبغي أن يقربه أحد إني ما استطعت أن أبرئ أحدا منه ولا رأيت قبلي من فعل ذلك. He put principle. If it's non-operable, if it's advanced tumor, you should not touch it. Unfortunately, some people actually go for it and cause more harm and speed up the death of the patient. So he put the principle of when not to operate. Talk about the ENT. Yes, he described the tonsillectomy in great details. He made and put a drawing on a few instruments, the tongue depressor as well, and the guillotine as well. And he put some case report, and he followed this patient for a while and talked about this patient. Here, Raffensperger actually in his book, Children's Surgery, he described what Al-Zahrawi did in tonsillectomy and the guillotine used in his technique. Tracheostomy, الشق على إجراء الشق على الورم الذي يحدث في الحنجرة ويسمى قيلة الحنجرة. So obviously, if there's a tumor and you have to at least maybe maintain the breathing, you do the tracheostomy, and he described it in a very well manner. Anyway, eye surgery. Do you believe somebody over 1,000 years ago did any surgery on eye? Yes, Al-Zahrawi described the call it al-ma' al-nazil, the cataract. In some places they call it as-sad or al-ma' al-bayda or ma' al-abyad, by removing the lens. And he described in the very good details and described the instrument used. He put the instrument illustration in a great way. And not just only this, he in fact put little reference that during his time he heard that some people here وقد بلغني عن بعض العراقيين أنه ذكر أنه يصنع في العراق مقدحا نفوذا تمتص به الماء الأبيض. So it means like sucking the lens by using a special instrument. He said, I haven't seen it, I haven't read about it, but this is what I've heard. In fact, I had to ask people who are really interested in the history of ophthalmology. And one of my close colleagues, Dr. Zafir Wafai, who's in the state, he told me that, yes, Ammar ibn Ali al-Musri Kahal, he used to live the same time of Al-Zahrawi, between 1010, between 930 and died in 1010. He wrote on this technique in his book Al-Muntakhab fi Ilm al-Ayn. So it's interesting. Al-Zahrawi himself, he heard about something, he put it in his book. The things he did, he described it, and he described the instrument used. Interesting book, The Cambridge History of Medicine, talking about Al-Zahrawi's technique when he treat cataracts. Now moving to obstetric and gynecology, did Al-Zahrawi actually did anything? Yes, Al-Zahrawi, he described the normal delivery by teaching the midwives, because the midwives normally they used to do all the most of the jobs anyway. In fact, he only had to intervene with some very difficult cases. So how to do this, and he described also the Wilshire position, probably maybe over 800 years before Wilshire himself being born, and unfortunately, given the credit to him, Al-Zahrawi, he put it in the great details, Wilshire position. And also he invented a little mirror, how to examine inside the cervix. And this has been almost like the principle to do endoscopy, cervix endoscopy, and this interesting publications by in the Journal of Royal College of Physicians in Edinburgh in 2003, talking about Al-Zahrawi and describe him, the great Arab surgeon, Al-Bukasis of Cordoba, talking about uterine cervix glass mirror to view it. Great surgeon. Also, another topic on the treated vaginal aplasias and describing malformation in the female genitalia. And this is an interesting article talking about Al-Zahrawi, Al-Bulqasis, who describes successfully some conditions on this. And this is being published in the Human Reproduction in 2006. Also, he put differential diagnosis between cancer, warts, and abscess of the female genitalia. And this article published in the Proceedings of the Royal Society of Medicine. Great man. Also, he, in fact, he was definitely the first to describe the removal of dead fetus and how you do it surgically by using a proper instrument. He described the instrument al-mishdakh, as you can see it here, and also the forceps, the milqat, and two different milqat, two different forceps, tooth and non-tooth forceps. And this is al-mishdakh and the forceps. And obviously, Helen King, in her book, Midwifery, Obstetrics, and the Rise of Gynecology, mentioned this. And Abu Qasis, he used two kinds of forceps, and al-mishdakh, you should just put it ACHL, it's al-mishdakh instrument. It's interestingly as well, Abu Qasim probably may be the first who described ectopic pregnancy, when pregnancy can happen outside the womb. And he put this case report in his book, and this is well recognized by many other people, that Al-Zahrawi was the first to describe this. Actually, many people, and this is article also published on rare site of ectopic pregnancy in patient with uterus. This is actually starting the article on the ectopic pregnancy was firstly described by Al-Bukasis on the 11th century. It's interesting when you see a great, nice book, Making Women's Medicine Masculine by Monica Green, mentioned that Al-Bukasis, he dedicated his longest section on woman medicine and talk about the obstetric and the gynecology. Dental surgery, yes, he practiced dentistry, and he talk on removing teeth, how to wire loose teeth, how you put even dental arch bars, which we still use it as a technique nowadays in some of the fractures, of the mandible fractures. They use dental arch bars. He also described replacing loose teeth or missing teeth by putting a small implant made from cow's bones, and he put it in a great details in his book. And this is little article by Henry Noble, and describe how Al-Bukasis, how Zahrawi mentioned the transplantation in dentistry. Another little article by Italian dentist talking about Al-Zahrawi and his impact on dentistry. Great book. This is one of the pages talking about Qal' al-Asnan, removing teeth. And this is manuscript kept in Oxford. This is in Bodleian Library. You can see the page on Fasl al-Thalathun, Qal' al-Asnan and dentistry. Definitely, this is very exciting when you see one of the famous book, Health and Medicine. Prayota actually said definitely Al-Zahrawi, his work greatly influenced European dentistry. and developing of the dentistry in Europe. Neurosurgery, is it something being practiced 1,000 years ago? And by Al-Zahrawi, yes, Al-Zahrawi practiced neurosurgery. He opened the skull and he used different tools to open the skull, call it al-mithqab, to penetrate the bone and make a few holes and open in between. He said, you make the holes and then تقطع المقاطع ما بين كل ثقبين. And this is the same principle for craniotomy, which is, I'm sure, still being used till very modern time, remarkably very much like what we do nowadays to open this. And this is Louis Becky, and in his book, The Resurgence of the Past, talking about Abu Qasis al-Zahrawi and how he used the chisel and the instrument to very carefully open the skull. And also Fred Raymond mentioned this about Al-Zahrawi and the way he used his instrument in neurosurgery. Observations of malpractice he put, because being as a great surgeon himself, he used to see lots of cases comes from different areas, and he saw lots of bad treatment of cases. So he put his observation. He said somebody unfortunately removed a tumor from the neck in a female, which caused bleeding. Probably maybe that tumor wasn't really tumor, was some aneurysm or something should not even touch. He put on splinting as well, that somebody he put in Arabic, if somebody can read it, رأيت طبيبا آخر كان يرتزق عند بعض قواد بلدنا. Somebody was just practice medicine for the sake of getting money from one of the leaders in local cities. So not genuine physician. He was just only taking practicing for the sake of getting some money. So he put a full splint around the leg and caused gangrene because the compartment, definitely compartment syndrome. Also, he described somebody removed a large stone from the bladder and caused death. So this is actually can give us very important principle. We all know how to operate. We know all when to operate, but we quite important to know when not to operate. And this is the principle Al-Zahrawi actually quite strongly was stressing on. Also interesting when you read this word by Al-Zahrawi, keep away from anything which may negatively affect your reputation in this life and the hereafter, for it's better for you and increase your rank and please Allah subhanahu wa ta'ala. I mean, it's quite interesting. There's some ethical reflection and ethical advice is given in his book. Instrument, if you had a chance to go and visit Cordoba, you'll find in a small museum, in the Tor Museum, they put the replicas of Al-Zahrawi's instruments. Also in Aleppo, in Syria, Dr. Abdel Nasser Qa'dan, they produced in 2006 some of Al-Zahrawi's instruments. I really found the one in Fas in Morocco is quite fascinating. They improved it. This is actually photos taken in 2016 in one of the conferences, but the one in 2018 in Fas was really very fascinating collection of instruments of Al-Zahrawi and replication of the all instrument in many different aspects of sub specialties, in surgical subspecialties, all being collected in under a different collection and put in the exhibition. Also, Fuat Siskan, Marhum Fuat Siskan, who died a few years ago recently, the Turkish historian gentleman, died in Germany. Rahmatullah alayh. He produced a nice collection of Al-Zahrawi's replicate as well. So this is what you see. It's very much like state of the art. 1,000 years later, I don't think this too much has changed, I'm afraid. Great man, great surgical hands. It's fantastic. Now, Al-Zahrawi here is teaching his student Al-Hijama and how to perform Al-Hijama. This is a photos from the Wellcome Library in London. Al-Zahrawi, his book Al-Tasrif was translated into Latin and kept, obviously, the main reference, the main syllabus for surgery in Italy and France for a few hundred years. In one of the very famous French surgeons who wrote a big book called The Great Surgery, Chirurgie Magna, completed in 1363. He quoted Al-Zahrawi over 200 times. That's great to recognize such great Muslim physician, mashallah, Muslim surgeon. His book now, he's been translated into Latin and was the book to be taught in many universities in Europe. And definitely, as Argalata said, without doubt, Albucasis was the chief of all surgeons. Another Belgium book, the 12 surgical books, also written by Figens. He quoted Al-Zahrawi many times, over 9 times. And this is a few pages from translated pages from Al-Zahrawi books in different languages. As we mentioned here, many books has talked about Al-Zahrawi. This is the short history of medicine, and illustrated history published in 1987. You can see it's only recently, last 20, 30 years, books start talking about Al-Zahrawi. And this is why we need to make effort to spread the knowledge about our great physician, great surgeon. Another book, I mean, you see here the great influence the Christian West. Quite great to read this. History of Surgery, published in 2001, talking about Al-Zahrawi as well. And the Dictionary of the History of Medicine, published in 1999, also talking about Al-Zahrawi and his achievement. Cambridge History of Medicine, talking about Al-Zahrawi, this book published in 2006, and talking about his technique in doing cataracts. We mentioned Fred Raymond and his book published in 2006, History of Medicine. This is quite interestingly actually published by Dunn and Sutcliffe, talking about Al-Zahrawi. He's possibly the greatest surgeon, as you can read here, the greatest surgeon of the Middle Ages. His illustration was really fascinating. I found what Raf Steinberger actually in his children's surgery worldwide history, which published in 2012. He's a general surgeon, practiced in the USA, in America. When he wrote a few nice sentences saying, Albucasis himself, he wrote one of the most remarkable surgical textbook of all time, interestingly. And not only this, Albucasis, his own experience as a practical surgeon to describe specific operations. So Al-Zahrawi is not just only describing what somebody said before, somebody written before. He put it himself, and he practiced himself, and he described what he's done. In the BMJ, this is back to 1939. In BMJ, they published a little Nova Vetera, this little articles on the oldest ever manuscript discovered in England, which was discovered in 1250, in 1250. So probably maybe just over 250 years after Al-Zahrawi. In this manuscript, they discovered that over 44 leaves or pages from Al-Tasrif, from Al-Zahrawi's book. So this is included in this manuscript in details and talk about the instrument written by Al-Zahrawi. Al-Zahrawi definitely, he was a great surgeon, but he was also great teachers, a great surgical teachers. He had extensive surgical experience, and he taught us how to operate and when not to operate also. Practical teaching and training, and teaching his student to do it in a practical way. Not just only this, he had a clinical demonstration, observation on the bedside teaching. He takes his student and teach them how you see the cases, how you operate also. Also giving lecture with illustrations, because his book is full of illustrations and drawings. And he created and wrote one of the most important books in the history of Islamic medicine, Al-Tasrif. His book is really lots of references and a great book. And he, as we discussed, he made lots of emphasis on anatomy and the need to study anatomy before going into surgery. Contributions also to many surgical instruments. He described many surgical instruments, over 200 instruments. Also, he described we only discussed here the volume 30, but over the 29 volumes of the book, he talked about different areas of medicine and pharmacology on making medicines. And obviously, to be a good surgeon, you need to have some medicine, you need to have some sedations, and also the topical medications, the creams to use to treat infection and to probably maybe speed up wound healings. So he did lots of this in his book. And obviously, his legacy and influenced the generation in Europe. And interestingly, when you read this, definitely he remained the most used textbook, Al-Tasrif, his book, the most important used textbook of surgery for nearly 500 years. This is written in the Dictionary of the History of Medicine. And also not in surgery, also his work really greatly influenced European dentistry. And as I just mentioned before, his textbook was really probably maybe by different people, one of the most surgical or quoted surgical textbook of all times. Great. So by no doubt, he probably maybe, I would say he was the father of surgery, at least in the West. A great surgeon. And many translation to Latin, German, French, English, and definitely in Arabic, many books being published about Al-Zahrawi and his contribution to surgery. And many events, celebrating the millennium of death just over 10 years ago. I've written a few articles on Al-Zahrawi's achievement, mainly in plastic surgery and some in other parts of surgery. And I think it would be great if you had a chance to visit Andalusia, make sure you go to Cordoba and see many places named after Al-Zahrawi. So I think now we can go back to the first slide we put here. We can correct the slide, and definitely this is the way we should probably maybe teach our student. This is the way we should probably maybe the civilization's history need to be taught. And I always like to finish by this: only those who remember history can make history. Jazakumullah khair. Thanks very much. I put here just like a little link if you want to probably maybe take little pictures of this. This is the our YouTube channel, which all the previous, and inshallah this talk will be published in inshallah. Jazakumullah khair. Barakallah.
Jazakallah khair, Dr. Sharif. MashaAllah. I'm impressed because of 2 points. First of all, the amount of Zahrawi, mashallah, he was expert in too many fields. These days you only see like people are specializing in one field, but mashallah, he was covering different fields. Also, the way you linked Zahrawi knowledge and work to recent works is also impressive, mashallah. Jazakumullahu khairan. We'll open the stage, inshallah, for any question or comment. If you just click on the hand button, you can raise your hand just to make the discussion in order, inshallah, or you can put your question in the chat box. Kindly, if the question or comment be within 1 minute, inshallah, so we can cover as much as we can.
I can see lots of surgeons here, and mashallah, there's a few surgeon consultants around. If they want to add, please feel free, mashallah. Barakallah.
We have one question in the chat. Do you want to read it, Victor?
Tell me, Akhi, I'm sorry.
It's a comment, yeah,
okay.
By Brother Z. Inshallah. Brother Ihsan, تفضل أخي, بسم الله. If you can open the video as well.
I'm sorry that I cannot open the
problem.
video for some reason. And I would like to just thank to Brother Sharif Al-Ghazal for this excellent presentation. As a matter of fact, I had listened to this presentation physically in Kuala Lumpur last year, and it was a great lecture again. And through this Zoom meeting, some of the brothers in the loop did have a chance to listen to this very informative presentation. And actually, Brother Sharif, as the leader of the HI-FIMA History of Islamic Medicine group, he did very good work, and for the next generation, it will be a very good activity. Inshallah, we will follow him in this very successful initiative. Thank you very much once again. Jazakumullah khairan kathira.
Jazakallah khair, Brother Hassan. Professor Hassan, he's a urologist in Istanbul. He was the ex-president of FIMA. And mashallah, he's been quite active. I think he produced also a talk for the FIMA series here.
Yeah, Jazakallah.
بارك الله فيكم. أخي أبو أيمن تفضل brother.
السلام عليكم.
وعليكم السلام ورحمة
الله. Dr. Majid Katmi, Abu Ayman, again I like to thank our teacher now, Brother Sharif Al-Ghazal, for his good, excellent presentation. In fact, I'm more inspired learning from him more and more about the unknown past of our great Islamic medical civilization. I only want to quickly say a few quick comment suggestions. I raised it in one of the sessions in the past. It's very much needed quickly to work on putting the great Islamic medical civilization in all medical school in Arab and Muslim country. 99% and more, I believe, they don't know what has been done before. A second thing, suggestion for us in hospital, especially with non-Muslim doctors, they love to, when you do session, they do session every week, postgraduate education. Please introduce yourself. Would you like to know about our early Islamic medical civilization or surgery, like we discussed today? It will bring a lot of high education and invite generally Muslim, non-Muslim doctor in all hospital. Now, the other thing I felt also is very important to have a thought, to discuss one day, to make it a session by itself, why our Muslim doctor, Arab doctor today are at the end of the queue and no invention, no اختراعات, no paper published in BMJ and other. This is a serious weakness. We need to discuss it in detail in a big session, in a big conference. Why we have to copy everything while we are at the end of the queue. So this is my suggestion, to have a good maybe conference, etc., because the West know only these people, they know nothing, this Muslim and Arab. They came to learn from us. No, we were the teacher to your granddad and, and other. So we need to make it more practice and present what we got. And you never know, Allah will open the heart for a lot of people to know what type of qualities these people. Muslim? So what is in Islam? Make them so great and invent, etc., etc. May Allah guide us all, inshallah.
Jazakallah khair. Akhi, this is important point you mentioned on, as I call it, the integration of our great history of Islamic medicine into our university syllabus. Might be a bit difficult to impose it in all medical schools, but at least by educating ourselves as a Muslim physician, Muslim surgeons, everyone in his own field, by educating ourselves, and this is one of the main purpose, as I've just mentioned on the first of my talk, to try to empower ourselves, educate ourselves, and also to make, we only need probably maybe 2 minutes by the first of the talk to know the history of maybe plastic surgery. As a plastic surgeon, when I talk to my junior doctors, when my student, same in orthopedics, same in cardiology, the same in ophthalmology, in urology. I think that will be great, because I always believe empowering our students is really very important. Inspiring our students is very important. And also, it's when we have the tree with a big root, a strong root, this is the tree would expect to produce good fruits. You don't expect a weak tree to obviously to be as good as a strong. This is why I can read this. Jazakallah khair, brother Dr. Muqdad Rawi. He's a consultant plastic surgeon in the UK. Barakallah fi. I can read this comment. Also, there is a little question from somebody. I'm sorry, I don't know what you mean. Is there any records of Al-Zahrawi's School of Medicine? I don't know what's Al-Zahrawi School of Medicine. If somebody want to probably maybe. There is a plenty of talks on Al-Zahrawi. If you mean the teaching, that's probably maybe different ways. Inshallah, I'm going to produce maybe separate papers on the way Al-Zahrawi's methodology on surgical teaching, medical teaching, how his methodology of teaching. Medical school, if you mean where he taught, obviously it's not the same setting. It's the hospitals, Bimaristan, they used to practice. On Friday morning, I've just been invited to give talk in Jakarta, in Indonesia, and the talk was on the history of Islamic medical teaching. Inshallah, we'll try to do one event on this, how Muslim used to teach.
Inshallah.
That's a separate topic, a huge big topic.
Inshallah. Brother Zed, you can open your mic if you want to elaborate on your question.
Jazakallah khair, assalamu alaikum, brothers. Can you hear me?
Yes.
Yeah, Jazakallah khair. Akhi, thank you so much for the very, very enlightening talk. Yes, my question was exactly as you stated, actually. It was with regards to both whether there was any evidence of the actual location of his teaching school and whether it could be visited at all. And also indeed the techniques. I'm actually not a medic myself, I'm actually an architect, but for me it's that would be very, very fascinating, because I deal in hospital design in this day and age, and I'm sure that many of his what seems to be unbelievably advanced techniques for the time probably extend to the design of the building, perhaps, that he also was teaching his students in. Jazakallah khair.
Barakallah, Jazakallah khair, akhi. I'm sure by visiting Granada, and you can see the Qasr al-Hamra, Alhambra's palace. It's fascinating. It's a piece of art, akhi, mashallah. The way they take the water up, and the way they produce different styles of cooling techniques in the different halls, the different places in the palace itself. It's fascinating. I think from the medical school point of view, I might probably maybe leave it for one big talk on medical teaching and the history of medical teaching. It would be unfair now not to do this, inshallah.
جزاك الله خير. الدكتور عمار تفضل دكتور.
Dr. Ammar Darwish is a consultant general surgeon in Manchester.
We can't hear you, Dr. Ammar. Sorry.
What an amazing talk and enlightening. Can you hear me?
Yes, we can hear you now, yeah.
I'm just saying what an amazing talk, Dr. Sharif, on this amazing doctor and Islamic surgeon. It's really enlightening. Whenever I talk about trauma or teach about trauma, I always talk about the history, go back in the history of war surgeries. And what I talk about, one example that I mentioned during the Islamic era is Al-Zahrawi. A lot of his instruments are still being used, like he mentioned. A lot of his techniques are still being used. For example, neurosurgery in trauma, you do craniotomies to evacuate hematomas in trauma, and we still teach that. We still tell people that these are still used, and I always remind them of these great scholars that we have. What's more fascinating is his ethics of practicing medicine and surgery. Would you elaborate a little bit more on that? You mentioned where he taught his students when to operate and when not to operate. Consent. Would be great just to have a little bit more elaboration on that, Dr. Sharif. And thank you so much for all your efforts and your talks, and for Dr. Abdul Karim for organizing it.
Barakallah. Akhi, the ethics itself, again, this is a big topic, which I discuss it in a separate way. And the history of medical ethics, it's fascinating. We had one talk, if you go back to the same series produced by Dr. Hassan Shamsi Basha. Again, mashallah, was a great talk. There's books published in the history of Islamic medicine on purely medical ethics, like Tabari, Firdaus al-Hukma, like Adab al-Tabib, Al-Razi. Al-Zahrawi himself, he put some reflections on things. When he speaks in many details on obstetrics, he keeps the confidentiality, and he always empower the midwives. He tried, because obviously treated by different sex, by treating female by male, unless if it's something really, really important. Also, if you read Al-Tasrif, I read Al-Tasrif, the volume 30, the surgical part, almost from one part to the other, completed. It's fascinating, akhi. Every time he starts, inshallah, alhamdulillah, nad'ullah, the guy is full of, mashallah, he's a great status, belief of Allah subhanahu wa ta'ala. He always try to, by the way, he is one of the very few known Muslim physicians never even present his book to the leader, to the ruler of the country, as many used to do in that time. He only put it to his own student, to his own children. And in fact, two of his granddaughters practice medicine, because medicine and females is a great issue in our history. Lots of female physicians known to do this. So the guy, he gave lots of ethical side. Yes, I think the way not to operate when it's non-operable is quite important, because the issue comes from causing no harm. Because if you feel as a surgeon you're going to cause more harm, this is obviously against our belief as a Muslims, and this is important. I can see here Dr. Atif Hakmi as well with us, if he wants to add on orthopedics side, because I mean, he's a consultant orthopedic surgeon in the south near London, so he probably maybe want to add something as well from the experience. It's very, I put it in a way to do it as a comparative, what we do now and what Al-Zahrawi put. And by intention, when I prepared the talk, I tried to keep the manuscript in Arabic, so at least the people can read what Al-Zahrawi really said in each part of the.
Dr. Atif, تفضل.
Can you hear me?
Yes, yes.
بارك الله.
جزاك الله خير أخي أبو شريف. أخي شريف, it's amazing, fascinating. يعني the amount of information we heard and we learned is amazing, and of course that's your effort, and of course the main regards to Abu al-Qasim, mashallah. It's nothing really to add from the orthopedic point of view. I was in my mind, there's a question, and I'm planning to do some paperwork about it, study, because I'm interested in diabetic foot surgery, and I do a lot of that. And of course, diabetes is a new concept or a new disease in the modern world, or at least I don't know if there was any diabetes from your research, from your studies, from your work, if the diabetes was well known 1,000 years ago. I'm sure there was, but maybe described or not described. And of course, diabetes can affect, does major problem to the development of shark of foot and ulcers. And we know now doing amputation in diabetic people, there are like almost 40% chance of mortality within 4 to 6 months time from the time of the amputation. So this is quite significant now in the world, but I don't know if that's been was known in the past or been practiced. I know they treatment with honey and for ulcers and infected wounds, but I'm not sure about if there's anything from your knowledge about diabetes and diabetic foot surgery.
Yeah, I mean, obviously, Al-Zahrawi himself as a surgeon, as physician, and other people like Ibn Sina, they do have different ways of making diagnosis and looking at the urine, and if the urine is actually is a bit coming from a diabetic patient, how the ants will probably maybe come and probably maybe attract the ants or not. There's a lot of talk. I'll probably maybe send you some articles on this, inshallah. But Al-Zahrawi himself, as a surgeon, I think he dealt with lots of amputation, because amputation is not only as a war injuries and injuries, amputation for the need of amputation for different reason, even vascular reason, because can happen, because he described many other vascular reasons he dealt with also. Yeah, but I'll definitely get back to you, inshallah, for the diabetes itself, inshallah. I can see Professor Hussam Fadil as well from the United States, mashallah, with us. If you want to add on the gynecology side.
Yeah, assalamu alaikum. How are you? I enjoyed this talk very much, very interesting. Obviously, he did contribute a lot to the obstetrics. He described many of the obstetric procedures.
Dr. Hussam, the sound is not very clear.
I'm sorry. Do you hear me better now or no?
It's a little
bit better. If you please make slightly louder.
If you get closer to the microphone, it'll be, yeah.
Zahrawi did this, contribute a lot to the obstetrics. Any better now or not? Let me put another microphone here. Okay, once if you hold for a second, maybe.
Yeah, no problem.
Or somebody can.
Yeah.
Another.
Exactly. In the meantime, respected brother and sister, if you can join, I just put on the chat box, if you can join us in the WhatsApp group and subscribe to our YouTube channel. We're trying to grow up this little project, inshallah, so extend for a long time, inshallah. تفضل دكتور حسام.
Assalamu alaikum. Is it better now?
نعم أحسن. تفضل بسم الله.
Is it better now? You can hear me better?
Yes.
Oh, okay, Assalamu alaikum. As I said, I enjoyed this presentation very much, very interesting, mashallah. Yeah, there's a lot of contribution to obstetrics. He did describe several procedures in detail, including what we call internal pedalic version, evisceration. He used procedures like craniotomy. He invented a lot of the obstetric instruments that we use right now, like the cranioclast, the cephalotripe. And he was also the first one to describe extrauterine pregnancy or abdominal pregnancy, and many cases of the what we call placenta previa or abruption. And he's probably known to be the one who first described hemophilia, as a matter of fact. I don't know if that is confirmed. So, I mean, he did have a lot of contribution to obstetrics and gynecology. He did actually design the vaginal speculum to help in the vaginal examinations or gynecological examination in general. So he had a lot of contribution. And as Dr. Sharif mentioned, all what we know, at least I know, about his contributions is related in this volume 30. He's talking about surgery. I have not really have access to the other 29 volumes, and I'm sure, like Brother Sharif mentioned, there's a lot of information there from pharmacology and pharmacy and medicine and other stuff. So he is a great, he was a great surgeon and a great Muslim surgeon. I second what Dr. Sharif said, that he was always, every more or less paragraph, he mentioned Allah, Bismillah, Inshallah, and so on. So he was very cognizant of the power of Allah in the cure and the medicine field. Jazakallah khair.
Barakallah.
Jazakallah khairan. I think we reached the end of this session. We are enjoying every moment of it, mashallah. That's it for today, inshallah. Jazakumullah khairan, everybody. Thank you again for Dr. Sharif for enlightening us about very useful and professional presentation. Jazakumullah khairan. And as I said in the chat, if you can join us in WhatsApp group, spread the knowledge, spread the information about this little project, so we can grow up together, inshallah. Jazakumullah khairan, barakallahu fikum jami'an. We'll see you, inshallah, in the next lecture. Jazakumullah khairan. Assalamu alaikum wa rahmatullah.
Jazakallah khair. Jazakallah khair, Brother Rahman. Assalamu alaikum.
Wa alaikum assalam.